our State House studio in Montgomery. I'm Todd Stacy. Welcome to Capitol Journal. Today was the 19th day of the Alabama Legislature's 2024 regular session. That means there are 11 more meeting days remaining that can take place over the next month and a half. We've been anticipating the next steps on the issue of gambling. As a refresher, earlier in the session, the House passed an expansive, comprehensive gambling package that would institute a state lottery, expand and regulate casino gambling, and legalize and tax sports betting. Weeks later, the Senate made significant changes to that plan, sending a scaled back version with no casino expansion, no sports betting, back to the House. Today, the House voted to non-concur with the Senate changes and request a conference committee of members from both chambers to work out the differences. This is pretty common with legislation. However, on this issue, the House and Senate versions of the bills are drastically different. The sponsors of the House gambling plan said today they are hopeful to reach a compromise.
We're going to take it up next week in conference. Representative Jones and Representative Blackshear will represent the House. Again, what the Senate had passed was nowhere near what we had passed in the House. We had a lot of great concerns about that, so we'll work it out in conference and see what we come up with. We left a lot of money on the table, as you see, and some of the things that they had done or left out of their package was simply unacceptable to the House. Some things we're not willing to compromise on, and that would be an educational lottery. Let's talk about sports betting just a minute. That was taken out of the bill as well. Over 2 million illegal hits at sports betting last year were blocked within the state. It's estimated $3 billion were bet illegally on sports betting within the state. That needs regulated. That needs to be taxed. That needs to be brought under control, and that was completely left out. That was just not on the table.
In a curious twist, the Senate did not vote to go to conference committee today, adjourning before taking up the House's request. Senator Bobby Singleton, who was among the gambling proponents in the Senate, said he expects a vote to go to conference when the Senate returns next week.
People who can use it in terms of young adults or their addictions and things of that nature. I think there's a way of handling all that. I think there's a way of putting in some parameters in there to be able to safeguard those things. Other states have done it. Other states are successful at it. We don't see a lot of addiction and things of that nature in terms of young adolescents, adults that are playing these games. I think we'll find a way to make it work. I think the House did a great job and did a lot of research that we in the Senate didn't have an opportunity to look at that research that they did. I think this conference committee can sit down. We can come back, work through this body. We are not in a hurry. We got up until the last day of session before we can report out. So we don't have to go into conference today and be out today. So we have an opportunity to go through it, study it, talk to members, see what they're liking, what they're not liking, and give it an opportunity.
I'll get more in depth on the gambling issue with State Representative Sam Jones later in the show. On the House floor today, a somewhat surprising turn of events. A criminal justice reform bill failed a procedural vote, making its likelihood of passage remote. House Bill 29 from Representative Chris England would allow those sentenced to life without parole for nonviolent offenses under the habitual felony law to be eligible for resentencing by a judge. After some debate, the House took up the budget isolation resolution, a procedural motion required to pass bills before the budgets are finished. While a majority voted to move forward with the bill, it did not get the 3/5 majority required.
It's commonly called the Second Chance Bill. It deals with habitual offenders who were sentenced to life without parole and who are currently serving in our prison system. One of the things that we've heard a lot of is that there's a potential for individuals to be released that may have harmed someone in one of their priors. So if this bill were to get the BIR, I'm going to offer an amendment to it that says that the individual has no prior convictions for any offense involving physical injury to another person. So in order to be eligible for resentencing, none of the priors that you have that led to your life without parole sentence can involve a physical injury to another person. There were also several issues that were identified by the district attorneys, including the additional workload and the notice that they may be required to do, and we've come up with amendments to try to deal with that as well.
Visiting the legislature today were dozens of advocates for gun violence prevention. The Alabama chapter of Moms Demand Action held an event at the State House and distributed information to lawmakers about the impact of gun violence in Alabama. They argue that stronger laws to prevent gun violence would save lives and save taxpayer money.
Here in Alabama, our gun violence rate is one of the highest in the nation. So we rank 5th of all the 50 states. When you look at states with stronger gun laws, you see far fewer deaths. In fact, what we learned today is if our gun laws were strengthened to the level of states with stronger gun laws, we would save 12,000 lives in Alabama over the next decade.
One of the things that we like to bring up is the idea that whether or not you feel like you may be impacted by gun violence, even the conservative lawmakers can understand the amount of money that every taxpayer is putting in to support these violent crimes. On average, about $700,000 per violent crime, whether it's a homicide, which brings it closer to $1 million, or just an injury. The cost to the taxpayers is huge.
In terms of actual legislation, the group supports House Bill 36 from State Representative Philip Ensler, which would prohibit auto sears, devices that can be attached to a handgun to effectively turn it into a rapid-fire machine gun. Ensler says the bill has bipartisan support.
HB 36, it mirrors federal law, so this is already banned on the national level, but we just want to give a tool to local law enforcement and our district attorneys in the state to be able to prosecute on the state level. And what it is people are on the end of handguns putting trigger activators that turn that handgun into a machine gun. It's very hard to fire or to control it once it's fired, so they're very deadly, they're very dangerous. So all we want to do is support law enforcement, support our district attorneys, give them another way to deter and to fight this. It got through the Judiciary Committee with unanimous bipartisan support, so that shows it's not a Democrat issue, Republican issue, it's not rural, urban, it's something that impacts everyone. So the hope now is we get it to the House floor, get it through the full House and then on to the Senate.
An update on a piece of legislation passed earlier this session. Senate Bill 1, known as the Ballot Harvesting Bill, was passed and signed into law 2 weeks ago. Today, a group of voting rights advocates filed suit in federal court to have the law overturned. The Alabama State Conference of the NAACP and the League of Women Voters argued that the new law will disenfranchise voters, including elderly and disabled voters, who may need assistance in the absentee voting process. The law makes it a misdemeanor to return another person's ballot application or distribute an absentee ballot application that is pre-filled with information, like the voter's name. It would become a felony, punishable by 20 years in prison, up to 20 years in prison, to pay someone to distribute, order, collect, deliver, complete, or pre-fill someone else's absentee ballot application. Alabama Secretary of State Wes Allen responded by saying, quote, "I stand firm in my support of SB 1 because now, under Alabama law, Alabama votes are not for sale." When we come back, I'll sit down with State Representative Sam Jones to discuss more on that gambling issue. After that, I'm joined by Whitfield Hospital CEO Doug Brewer to talk about the proposed Alabama Health Sciences School in Demopolis. Stay with us.
You can watch past episodes of Capital Journal online at video.aptv.org. Capital Journal episodes are also available on APTV's free mobile app. You can also connect with Capital Journal and link to past episodes on Capital Journal's Facebook page. And you can listen to past episodes of Capital Journal when you're driving or on the go with Capital Journal podcasts.
Welcome back to Capitol Journal. Joining me next is State Representative Sam Jones from Mobile. Representative, thanks for coming on the show.
Thank you. Thanks for having me.
Oh, well, guess what we're talking about? Gambling. Last time you were here, I guess y'all had just passed the comprehensive House package.
Right.
Went upstairs to the Senate. They made a lot of changes to it. Pretty, scaled it back significantly. So today, y'all have voted to non-concur with those changes and say, hey, let's go to a conference committee and work out the differences. Talk about what led up to that non-concurrence vote.
Well, there were a lot of things that changed in the package that we sent to the Senate. One of the important things was that the education lottery was not named the education lottery anymore. It was just named the lottery. And that was something that was extremely important to us, that those fundings that would come from lottery would go to improving our education system, our retention of teachers, our technology exchanges and things of that nature. We thought that was very, very important in Alabama today, and we thought that that's something that we could possibly address in a manner that we haven't been able to address in the past. Mm-hmm. So that was a key to it. Some of the other keys to it was, I think one of the other things was the date for the election was changed to September from November. I can't rationalize why that was necessary.
It was a political thing, right?
It had to be strictly a political thing, and that didn't come into play when we did our meetings and working it up. It was a bipartisan bill. We worked together on it for 13 months. We looked at every area of it. We researched a lot of areas of it. Sometimes we had situations where we thought differently on how we should approach things, but we were able to reach some common ground and it really came up with something that everybody could support. And when we sent it to the Senate, we were quite optimistic that we had a very, very good bill. We had a bill that actually covered a lot of different areas of the state as it relates to how we were going to have gambling take place in Alabama, how we would control it and regulate it, how we would put it together, how the games would be set up in the state and the locations and where they would be and not oversaturated. And that was a lot that went into that package. It took a long time to put it together. And it was somewhat disheartening when it took about 4 to 5 days to dismantle it. So we're at the point now where we go to conference committee, we try to work out some differences and keep it moving. We are still optimistic about what we did.
Yeah, it was curious today because the Senate did not take it out of the basket, right? So they have not yet voted to go to a conference, and maybe that's reading into it a little bit too much. But let me ask you this, because what the Senate has said, a lot of the senators have said, is look, what they passed was as big as they can possibly get 21 votes on, and anything added to that, they peel off votes, things like that. So we'll leave that as it is. But what about the House? What kind of changes, what kind of closer to the Senate would be acceptable to get the kind of support in the House? And I'm really thinking about the Democratic caucus, because I've argued gambling doesn't pass in the House or the Senate without Democratic support. And I know, y'all have priorities about health care and things like that. So I wonder what would it have to be to get the Democratic caucus's support, or most of it?
Well, I think a number of things. I think the bill that we sent to the Senate really got 100% of caucus support. I think that there are various things that had to happen. The one we talked about as far as the education lottery is one of those things. The other thing would be the date that the election take place that was changed. What has happened in the Senate, they decided to do away with casinos and just bidding on casinos and have pari-mutuel gaming, which is very similar to what we have now at the various tracks that were already operating in the state in those various counties. I think there can be some negotiations in that area. I don't see that as being a major issue to negotiate. We lose some revenue in doing that, but I think that can be negotiated. The other things would be, we think that it's time for this state to address the issue of health care in rural areas, of mental health throughout the state of Alabama, as well as quality of life issues as it relates to our state as a whole. So we were really interested in the substance of the bill as well as we were interested in the revenue that would become available to address many, many issues in the state. That some are already on the books to be funded, and we really need to look at those things, because to me, gaming for just gaming is not something we can afford to do. We have to be able to control it. We have to be able to gain revenue from it to do things we have not traditionally done.
It seems like, because when they took sports betting out, that was a huge revenue component. And so that really gutted the revenue part. Do you see any willingness from the Senate to talk about sports betting, or is that a non-starter upstairs?
We have not really talked to them about that. We have not talked to them specifically about anything as it relates to how we put it back together at this point, because we haven't had a conference committee meeting. But I think that a lot of those things will be on the table. The one important thing that we have to realize is that the revenue sources that was in our legislation was estimated to be about $1.2 billion. I would say that with the actions the Senate has taken would be about $400 million in that area, and most of it would be the lottery. Well, if that's the case, then I don't think we can do education justice with that. So that's one of the issues that will be a top priority as we move forward, how it's structured.
Well, look, let's play this tape through to the end, because there is still a pretty wide disagreement. And I know conference committee, it could work out, but let's just say it doesn't pass this year. Again, you know, this is about as close as maybe the state has ever been to something like this. Where do you go from here? Because, I mean, if the Senate just won't, you know, if y'all are so far apart, what can happen to the gambling issue if you just can't agree?
Well, you know, the amazing thing about it is that the Senate has sent gambling bills to the House in the past. The amazing thing to me is some of those various issues that was cut out of our bill, they included in theirs, and we kind of
back in 2021.
We kind of used that as a way to get started. So that was somewhat surprising to us.
Yeah. Well, the votes have changed, right? There was an election in between. We kind of did some analysis in Inside Alabama Politics about, you know, this vote changed. You had Del Marsh up there kind of leading the charge. That's changed. And so it's interesting, you know, elections have consequences. Things change even if over a couple of years. But look, we're out of time, but I really appreciate you coming on. And we're going to ask for some follow-ups, because as this conference committee gets started, we want the inside scoop, okay?
We'd be happy to talk to you.
Safe travels back to Mobile.
Thank you.
We'll be right back.
You can watch past episodes of Capitol Journal online anytime at Alabama Public Television's website, aptv.org. Click on the Online Video tab on the main page. You can also connect with Capitol Journal and link to past episodes on Capitol Journal's Facebook page.
From 1820 to 1826, Cahaba was the first capital of the state of Alabama. The capital city was located at the convergence of the Alabama and Cahaba rivers because Governor William Wyatt Bibb had arranged for a free gift of land for that purpose from the federal government. An ancient Indian earthwork was found on the site, so the governor reused it as a dramatic centerpiece for the town plan. The sale of lots in Cahaba built the state treasury for the new state and paid for the first state house. Soon the frontier capital had 2 newspapers, numerous businesses, a theater, and nearly 1,000 inhabitants. Despite the loss of the capital to Tuscaloosa in 1826, Cahaba as a county seat grew into one of the wealthiest communities in the nation and did not become a ghost town until well after the Civil War. Cahaba was added to the National Register of Historic Places in 1973. Today it is known as the Old Cahaba Archaeological Park.
Welcome back to Capitol Journal. Joining me next is Doug Brewer, CEO of Whitfield Regional Hospital in Demopolis. Mr. Brewer, thanks for coming on the show.
Thanks for having me, Todd. I appreciate it.
Well, we're here to talk about the Alabama School of Health Sciences. It's, you know, planned for Demopolis. But before we get there, I wanted to ask you about your background as a healthcare professional.
Absolutely. Been in healthcare for about 34 years. It's hard to believe, but it has been that long. Spent most of my career in large hospitals all over the country, St. Louis, Missouri, Atlanta, Harrisburg, Pennsylvania, El Paso, Texas, but came to Birmingham about 7 or 8 years ago with the Tenet organization, and then joined UAB. I was blessed to be able to join UAB, and for the last 6 years I've been in Demopolis and loved every second of it.
Yeah. Okay, so that brings me to the point. Alabama School of Health Sciences. It's this. We have the School of Fine Arts. We have the School of Math and Sciences. All these specialized schools, and the new planned one is for health sciences. I mean, it's a really great concept. So talk about that concept, why you're behind it, and what it can really mean for the state.
Well, it hopefully will be a game changer for healthcare in our state. Our state has some of the highest incidence rates of COPD, hypertension, diabetes, you name it, and we rate very high. And about 60% of our population are in rural areas. And so it's very difficult in rural areas to get healthcare professionals there. So this school is designed to provide professionals all over the state, but we've put together a really strong coalition with hospitals across the state, and we intend to work with those hospitals to bring students from all over the states, 9 through 12. Mm-hmm. And our plan is that we're going to get them immersed in a healthcare program that will allow them to come out of high school, be able to go back all across the state and provide care that's needed to begin to change some of those numbers. Because at the end of the day, we know that particularly in rural areas, kids that grow up in rural areas will go back to rural areas if there's a good job for them to be there. So that's the real plan. But again, this is going to be able to produce healthcare workers for all over the state with a real focus.
And I imagine as a CEO, I mean, workforce is a big part of what you have to do, right? And that's a big part of it.
Absolutely.
So when I hear feedback from the legislature, the one criticism I have, or maybe question that gets brought up, is the location. Demopolis. It is rural. It's remote compared to some of these other schools in Birmingham, Huntsville, Mobile. So why Demopolis, and how can that work in terms of recruiting students to actually come and stay there?
Absolutely. 6 years ago, I would have asked the same question, spending most of my career in large hospitals. But I'm a UAB employee, and one of UAB's goals in coming in to operate the hospital was to go after that chronic care population, to be able to try to begin making a difference. We've been very successful in doing that, and along the way what we learned is that it's a great training environment. If you've got the pathology, then guess what? We can train professionals in it. So over the last 6 years, we've turned into as much an education facility as we are a healthcare facility. We have fourth-year surgery residents from UAB that are training with our surgeons at our hospital, because they are UAB surgeons and professionals and professors that live there. We work with the University of Alabama's FPOB program. They have 2 of their fellows that live right on campus, and one of their professors lives there, delivers all of our babies, so they're training their FPOBs there. We work with U of A's pre-med students. We bring them in their freshman year, and they get to spend time in the hospital and see how all these things kind of work together. What makes Demopolis ripe for that is the pathology, but it's also the fact that we're small enough that we can see how it all comes together. These students can in fact, the FPOBs, one of their requirements is they follow patients all the way through the system. They'll see them in the ED, see them in the OR, follow them up to ICU, follow them into med surg, then into our home health or whatever it may be, because the whole idea is to see how a continuum should work to care for these patients. That's hard to do in a program like UAB's in down Birmingham. It covers 20 city blocks. It's very complex. You don't really see how the lab works with the ED, or how the ICU and diagnostic imaging work together. You can actually follow patients and begin to learn how it works.
So if the goal is to really improve rural health, it makes more sense to, like you said, from pathology sense, to be based in a rural area rather than an urban environment.
I would argue that we're good for rural and urban, and here's why. I mentioned I worked my first 29 years in urban areas. What I learned when I got to Demopolis was that I've learned a whole nother side of healthcare, because it's small enough for me to see how it all comes together. So it's made me a better administrator, even though I'm, been doing it for 30 years. And there's a lot to that. There really is, that I just can't overstress. We're going to turn out great MRI techs that are going to be able to go back to UAB and work, or Huntsville Hospital, and be among some of the largest, working in some of the largest hospitals in the state. Now, we certainly want to work with the rural hospitals too, to begin to change some of those metrics that I mentioned earlier.
Mm-hmm. Well, look, this is something to follow. I know, last year it kind of got dropped out of the budget, but the governor's pretty insistent and wants to make sure that it's one of her top priorities. So we're going to be following this through the legislature. But I really appreciate you coming on and explaining some of the specifics, because, we get caught up in the budget line items and the policy and things, but as a healthcare professional and as an administrator, we really appreciate your perspective. So thanks, Mr. Brewer, for coming on.
Thank you for having me. I really appreciate it.
We'll be right back.
St. Stephen's was chosen as Alabama's first seat of government and served as its territorial capital between 1817 and 1819. The first session of the Alabama Territorial Assembly met in the Douglas Hotel. A once bustling frontier town, the settlement of St. Stephen's sat atop limestone bluffs overlooking the Tombigbee River. Today, the long-abandoned town is referred to as Old St. Stephen's and is an historical park and archaeological site.
That's our show for tonight. Thanks for watching. We'll be back tomorrow night for our Week in Review episode. That's 7:30 here on Alabama Public Television. For our Capital Journal team, I'm Todd Stacy. We'll see you next time.